Hello everyone, this is Albert once again. So we are going to be talking about prostate cancer screening. My last video was about the signs and symptoms of prostate cancer. Now, prostate cancer screening typically starts between the ages of 50 to 70 years. Now, if you are among the high-risk population, men with family history or black African men, it is encouraged that you start screening as early as, you know, 45 years, even 40 years, especially if you have a family history, because with that, if there is anything, it can be detected early. Now, there are primarily two types of prostate cancer, screening or screening techniques. The primary method is the PSA, the PSA blood test, which is the prostate specific antigen blood test, which measures the proteins that are produced by the prostate. Now, a higher the normal PSA level for most men, in general, is it should be below 4 nanogram per milliliters. Now, this can vary, but the 4.0 nanogram per milliliters is it's the benchmark, but it can vary based off of age, prostate size and other factors. But the normal per, the textbook is 4.0 nanogram per milliliters. The other test, which occasionally, some physicians will conduct, is the digital rectal exam. It's conducted in the doctor's office. Doctor would insert a finger through your anus to feel if there is any change, in size of your prostate, or in general to examine any abnormalities, of the prostate. So those are the two methods of prostate cancer screening. Now, a higher PSA level does not necessarily mean that you have a prostate cancer, or guarantee the prostate that you have a prostate, cancer. Now, if you have a higher PSA levels, other factors can lead to that. An example is an enlarged prostate. An enlarged prostate can elevate your PSA levels. So, but once a PSA blood test is conducted, and if it is established that your PSA levels are higher, then further diagnosis would have to be conducted in order to establish that you have a prostate, cancer. But a higher PSA level does not guarantee that you have a prostate, cancer. Now, for most men, the frequency of screening, for most men, it's 2 to 3 years. But if you're at a high risk, then your screening probably is going to be a little bit different, and you and your doctor can kind of decide that. So abusiafo, ne video yi na de ye bedi ho nkɔmɔ ne prostate cancer screening. Were only two types of prostate cancer screening. Yɛka prostate cancer screening na ɛkyerɛ sɛ sɛn yɛfa so ehu sɛ wanya prostate cancer. The di kan no ɛyɛ deɛ yɛfrɛ no prostate specific antigen. A blood test, ye twi mogya na yɛde akɔ lab na yɛakɔ akɔyɛ test. Na saa blood test no ɛna bɛkyerɛ sɛ o prostate no produce protein bi dodo anaasɛ improduce dodo. Sɛ produce protein bi dodo a, ɛno no kyerɛ sɛ biribi bi ɛrekɔ so, nti your friends saying normal prostate PSN was a year below 4.0 nanogram per milliliters. You know, nti say yade bia new prostate no a yetwe saa mogya no de collab na say ye results ne ba e was say results no a year below 4 nanogram per milliliters. The toso mienu say doctor office ho no doctor timede ne nsa wura sebi you know uto because prostate na be ho a nti doctor ne nsa wura uto a na wa feel say prostate no ne size no asesa o feel for say the was a tie no say ente saa na che say bibi koso and then na yesai a check other test, you know, but the obedika yen so ordinance a be sha woto anase ye be tru moja na ya run blood test. Now omo a mfie a ubedi ansa na wa started sa prostate screening usually mfie aduonum ekopem 70 years kura twi kan say enya de watwi 80, right? So between 50 and 70, right? Yeah, but in fear to do now in fear was a chance ye prostate screening for member to do no say we di in fear do num ho edeko. Now say wabusuamu prostate cancer wo mu a and there was a chance yentem obitimi a chance ye be in fear do 9 ho, you know, aduonanum edeko sa ehona no anase we ni patuntum a, you know, ni patuntum bia no de bia me ka kire mo starting them because ye at a higher risk, you know, nti we ni patuntum a se wonye nhyase ama woni wo doctor munni nkomo na on started prostate cancer screening. Now the empesa me san ka bi on so ye se ye koye blood test no PSA test na se o PSA no wo soro a eno no nkire se wanya prostate cancer because prostate no my last video am here say na wutie ya prostate no eye kese a be ma wunyini bia no prostate nti eye kese nti prostate no enlarge a etimi ma o PSA levels no ekoso, but the TNS say ye koye lab no wie na say PSA no wo soro a eno no ebe catch the doctor na say okay bia bibi koso e wo prostate no nti ye be run other test, you know, just to make sure say when your prostate cancer and now say prostate na enlarge keke, you know. Inti na prostate cancer screening no the tiano no inti ye dibesia e bia meka say prostate cancer to say ya bia na cancer in general no to say ya bia say wo screening time na say hunu ntamo a na ubetimi anyina che say ye hunu ntamo a ebekun ye hunu later ne bibeni ho abeje wonkwa, you know. So maintenance say hunu say bibi koso ni po duamo a pacho ma wono doctor nkasa maintenance e mani too late, right? So when you follow me akona ko follow me who question be a ubetimi send me message, you know, through YouTube, you know, TikTok and Instagram. Send me a message and then na yankasa. If you haven't followed me yet, please go follow me. Send me messages if you have any question. These videos are basically just to explain so that people have an idea, you know, on what to look out for. But if you need an in-depth details about something, anything about cancer, an in-depth, you know, detail about it, please send me a message. Send me a message, you know, and then I would find the time to explain to you. Sorry, my kid is back from school, you know, making some noise here. But yes, if you have any question, if you need an in-depth, you know, explanation about something, please send me a message, and then I would answer you. All right. My next video, we'll talk about the treatment techniques. See you then. Peace.